So I'd just like to begin by thanking all of GV Health staff who are continuing to work tirelessly in relation to this outbreak. We're a number of days into it, well, of course well over a week, and there's many people working across our COVID operations but also our normal day-to-day operations. They're working long hours and double shifts and really hard just to keep focused on maintaining the core services that our community needs at the moment in regards to the outbreak, but also in relation to the hospital services such as our ED, pharmacy services, pathology services, cleaning, catering. Everyone's doing an almighty job to contribute and make sure that we keep those services running. So there's 96 active cases in Shepparton at the moment. That's 9 more than the last reporting period. Already today we're seeing again there's more positive cases being detected, so that means the virus is still spreading in the community, and of course that's a concern to us absolutely, in terms of not being able to quite contain the spread as what we would like at the moment. So for that reason, anyone who has symptoms of COVID-19, no matter how mild they are, you need to come forward and get tested straight away. Don't delay that, and already some of the analysis that's been undertaken in relation to the testing that's occurred in the last 8 or 9 days is showing us that there is a delay between when people first have the onset of their symptoms. That delay can on average be up to 2 or 3 days to when they're then going and getting tested. Clearly that's not a good situation to occur, and because during that period people are infectious, and as they're going about whatever those daily activities might be, there is greater opportunity for them to be spreading coronavirus in the community, and that's certainly what none of us would like. So as soon as you get any symptoms, no matter how mild they might be, cough or runny nose or loss of sense of smell, come and get tested straight away. There's really good access to all of our testing sites right across Shepparton and Mooroopna at the moment. There's a couple of exposure sites that we're concerned about still at the moment. So again, if you have been to an exposure site, and the exposure sites keep changing regularly, there's a number being added daily into the Department of Health's website. That's your single source of truth regarding exposure sites. So it's coronavirus.vic.gov.au. There's 3 particular sites that we really are strongly encouraging people to come forward and be tested. The first one is the Sky Salon hairdressing service in Vaughan Street, Shepparton, and the particular dates are from the 15th to the 20th of August. The Community Centre at Central Park Recreation Reserve in Shepparton from the 13th to the 19th of August, and the Sir Ian McLennan Mooroopna Centre from the 13th to the 19th of August as well. Those areas, those exposure sites, we're particularly keen for people to come forward and be tested. We're not getting the numbers that we would like for people who have been to those venues to come forward for testing. So again, any symptoms and anyone who's been to an exposure site, come forward and be tested straight away. In relation to day 13 testing, so tomorrow will be the first day for some people in the community in relation to when their day 13 falls. So any primary close contact who has been advised that they're a primary close contact needs to have testing on or around day 13. So certainly not any earlier than day 13, but day 13 or 14 is okay. All of the information we are planning to share is going to be communicated through the school network primarily. That's where we know we have a large number of primary close contacts. So the schools are going to be provided with information later today that will be shared amongst the school community to provide details about when and where testing is going to occur. In relation to what your day 13 is, the best source of information and the single source of truth is the official communication and the letter that you have received from the Department of Health to advise you of when your day 13 is. So please rely on that as the single source of truth, as I said, because that's where you'll know when and to come forward and be tested. In relation to the planning, we're really well prepared at this stage, and that work is continuing in terms of making sure we've got adequate capacity and volumes from a testing point of view to cope with the demand that we're anticipating in the coming few days. We will provide some advice to community members about just to try and manage that demand across the course of the coming days. And again, that communication will occur through the schools and also through our Facebook pages. So please keep an eye on our Facebook pages in relation to that. Happy to take any questions that you might have.
Have you managed to get any staff back with downgraded tier sites?
So we are working through, at the moment we have still over 530 of our staff are furloughed, again because they've been to those exposure sites. We have managed to return 17 as of today with a different process that we have in place following some special permission we've received from the Chief Health Officer to do that. But pleasingly, as a few of those larger school sites have now had their classification downgraded from Tier 1 to Tier 2, we expect in the next 24 to 48 hours that we'll have a number of staff coming back to work. But at the moment that number is over 530 staff who are furloughed.
On the subject of day 13 testing, Thursday will be one of the busiest days. Are you confident that everyone who requires a day 13 test on Thursday will get one to allow them to leave quarantine by or after day 14?
So at this stage, the numbers we are planning for in relation to what will be the peak day 13 number, which is Thursday, is in the order of about 1,500 primary close contacts that will require testing. On our busiest days towards the middle part of last week, we were able to cope with 3,500 people being tested in a single day. So I'm pretty confident we should be able to cope with that demand. There might be some queues and maybe people will have to wait, but if that advice is followed in terms of how we're planning to manage that demand and stagger the testing over the course of the day, that will really help everybody in terms of reduced waiting times and being able to move people through efficiently.
And further to that question about day 13, as some households who've been finding this particularly hard are starting to see a bit of light at the end of the tunnel for their isolation, what's your message to that community about the importance of staying the course all the way through your quarantine period?
Yeah. So if you break your quarantine, if you don't follow the advice and the requirements, in fact, under the public health orders, if you break your quarantine during the current 14-day period, you will have a reset of a 14-day quarantine period. So quite simply, although it might be tempting, and I know it is difficult for people to stay at home for a 2-week or 14-day period, but having come this far, I can only encourage people to hang in there and get through to getting your day 13 test, and then hopefully you'll be able to be released. Of course, if your test is negative, you'll be able to be released on midnight on that day 14.
Does it feel like we've got a better understanding of how the virus is spreading? I think it was 37 households they mentioned this morning at the government's briefing.
It's getting better, but again, I guess the concern we've got is that we're still having, what I would consider to be, relatively higher numbers of people testing positive. And really the goal at this stage is to get the number of people testing positive each day back to zero, and then we can start to reset things from there. But while we're still having positive results in terms of detections of COVID-19, that is a concern, and really people just don't delay getting tested. As soon as you've got symptoms, come forward and have a test.
Yesterday, Jerome Weimar made some comments of encouragement and praise about our community, and it sort of described us as having controlled this outbreak to a degree. Is it under control in your opinion, and what is the measure of success in crushing it?
So the measure of success in crushing it would be 0 positive cases for a number of days in a row, not just one day of course, but for a number of days in a row. I think Jerome's comments are right in the sense that we've been able to control it and not really see a large number of people testing positive and more wider spread infections across the community. So from that point of view, I certainly concur with his comments that it is controlled, but it's not under control. And that's really what we're aiming for, as I said, in terms of getting to 0 cases each day, and really that's going to be the ultimate way that we can get it under control. And it relies on every single one of us doing the right thing in terms of, as soon as you get those symptoms, get tested, or if you've been to an exposure site, get tested straight away.
That's all I've got.
I have just one or two more. In terms of vaccinations, has this outbreak had a positive or negative effect on the number of people getting vaccinated in the GB?
So in the last week, we've had at our hub site at the showgrounds around about 4,000 people vaccinated. There's plenty of appointments available for people wanting to be vaccinated, and of course that's again looking longer term about how we will manage to bring this pandemic under control. It's going to rely on everyone getting vaccinated. So if you haven't been vaccinated yet, you should book an appointment. The coronavirus website, you can jump online there, or you can call the 1-800 number, which is, just let me find that for you. You've probably got it there, 1-800 675 398. You can book online or through that phone number as well. So, but there's plenty of opportunities for people to be vaccinated. We're opening the hub at the Macintosh Centre until 8 o'clock at night each Tuesday. It's open on Saturdays as well as business hours every weekday. And we're also considering how we might be able to extend the opening hours during the week on other days as well. So plenty of opportunities, and it's not just our vaccination hub. There's vaccinations available at GP clinics and pharmacies as well. So plenty of chances for people to get a dose in their arm.
So that 4,000 in the past week, would that be a decrease or an increase on our average?
It would be an increase.
Okay.
Yeah.
And we've received quite a few questions. People are really curious to know whether the positive cases that have recently been identified in Greater Shepparton were isolating during their infectious period or were in mandatory isolation. Can you tell us a bit about that? It's
my understanding all of the people who have tested positive in recent days were isolating and doing the right thing. On top of that, they are also linked to other known cases, except 2 people that tested positive yesterday. And that's not clear just yet because the contact tracing process and the interviews with those people are still underway, and the information that's coming from that still needs to be reviewed and assessed.
And I understand that 2 people have gone to Melbourne to be hospitalised from the Goulburn Valley. Have there been any more hospitalisations since then? We're seeing a small number of people coming in to the emergency department that are requiring additional treatment. It's interesting, what it seems to be at the moment in relation to the Delta variant is that, of course, there's respiratory symptoms that people are having, but it's also some gastrointestinal symptoms as well. So some nausea, but particularly diarrhoea. So if you are feeling unwell from feeling sick in the stomach or have diarrhoea, it could well be coronavirus as well. So don't necessarily think about only respiratory symptoms. Some of these other upset stomachs and diarrhoea is a sign that people have coronavirus, so come forward for testing as well. Okay, that's it from me. Thanks so much.
And good afternoon, everyone. So yesterday I spent a large part of the day visiting a range of the relief efforts right across Shepparton. The effort is enormous, and the amount of people who are working so hard and making sure that we're meeting the needs of relief for Shepparton is just amazing. There was probably over 17 organisations that are being coordinated within local government and as well with government departments and agencies. They're all meeting together, so the coordination is actually really quite impressive. We're making sure that we don't have people slipping through the gaps. That's not to say that we've caught everybody at this moment, which is probably why too I want to stress the importance of people reaching out if their relief needs are not being met. We do have solid food supplies and relief packages. All our referrals are being met at the moment through GV Care and through Red Cross and the ADF. We delivered over 700 packages to households. So that's 700 households that have received the relief needs that they need. Included within that number was 270 halal relief packs. It's only a snapshot though of what those multitudes of agencies are doing. That's just one arm of it. In addition to that, we're also seeing some of those critical needs like pharmacy and other material aid also being well met. Again, I can't stress enough that if people aren't receiving what they need, if they can call the 1800 number, it's 1800 675 398. And again, if you've got specialist needs, then please tell the people within that referral line what it is you need. We are still seeing some demand for specialist products, and that relates usually to things that will tend to run out a little bit quicker. Things like your perishable goods, also specialist needs, be it baby formula, etc. Those sort of things are probably what it is that's continuing our demand. The rest of it, I think, is actually now we've got good solid supply. The other thing that I would like to ask community members is, again, still check on your neighbours. Make sure that everybody's okay, that we can ring through, see if everybody's all right and they are getting the relief that they need. As Matt said, as we move through to some of those key testing days, we will start to see people move back into the community, again within the current state directions. But we can't become complacent. It's so important that we aren't complacent as people again start moving into workforces where they're essential, and things like maintaining that social distancing, all the things that come with trying to keep this virus as best controlled as we can. It is still in the Shepparton area, and as I said, whilst we will meet these relief needs at this time, we cannot afford to become complacent at all. It's a virus that just spreads so rapidly, and we've seen that how quick it took hold within Shepparton area. Again, could I please thank the community for their absolute support, and particularly those agencies who have rallied around and worked with us to make sure those needs are met. The Victorian Multicultural Commission is working with us at the moment to make sure that all our ethnic communities and multicultural groups are also getting what it is they need. Again, there's a large working group that's being coordinated and making sure again that we can try and meet all those needs. Probably again, finally, please don't be complacent. Please don't be complacent even once you've moved into out of those quarantine and isolation restrictions. It still means we have to operate within the controls of the state and those directions from health that make sure that we keep as safe as possible. Look after everyone, and thank you again. Is there any questions?
Of those people in isolation who may still need to ask for help or may not understand what help is available or how to access it, in your experience, are there certain groups or demographics who are harder to connect with and provide that support?
Look, I think every community is different, and every community has its own characteristics, and I think it's what's probably is from my experience, what's best not to do is to make any assumptions that groups are necessarily well serviced just because you think they've got access to a phone number or a particular organisation. That again is why I say it's really important that we look a bit broader and make sure that we do catch those people that are possibly slipping through the gaps. As much as we've got key organisations, and be they look after particular arms of our very broad and wonderful community, it doesn't mean that everybody is networked and linked. So it often relies on the fact that personal or human nature picks it up, and it's things like, do you have an elderly neighbour next door to you? Do you have somebody next door that you're just thinking that actually I wonder how they're going? And it's okay to actually make the call as opposed to not make the call. Please make the call so that we can catch those people that might not be connected. It's so important. Whilst we're meeting the bulk of need and making sure that we've got a handle on all the referrals that are coming in, what worries us most is those that aren't connected. So as I said, it really relies on local community now to alert us to who that might be.
That's all from me.
Yeah, that's all from me as well.
Thank you.